comfortable with the side effects and just treating the side effects as they come about. We do encourage everyone, if when they are able to get a vaccine, to make sure you're well hydrated, make sure that you're well rested going into it, make sure you're eating properly, not missing meals, and that you have had a discussion with your physician on whether you can use an antipyretic, such as Tylenol, which is acetaminophen, or non-steroidal if needed. So we, again, recommend you talk to your personal physician regarding those recommendations. Thank you.
Thank you, Dr. Haight. That's great information. Dr. Adams with SSM St. Mary's.
Good morning. While many people have had mild symptoms from a COVID-19 infection, there are also many people who have had moderate to severe symptoms, and these symptoms can sometimes persist long after quarantine is over. This is currently being studied, and in the research, anywhere between 33 to 87% of people who required hospitalization due to COVID continue to report having symptoms even as long as 2 months after being discharged from the hospital. And even in people who never needed to be hospitalized, about 33% of them report that they're still having symptoms even after 3 weeks. The most common symptoms that seem to persist after having a COVID infection are the cough, shortness of breath, fatigue, and sometimes chest pain. But people are also reporting mental health symptoms like depression and anxiety, which is probably because they're feeling worried about not returning to their normal level of health that they had before COVID. So if this sounds like you, I would just encourage you to reach out to your physician and your healthcare team and engage them, especially if you're having persistent symptoms that have lasted many months. Some people are having symptoms even after 12 weeks, so after 3 months. Or if you have new or worsening symptoms after being through that acute phase of COVID, it's time to reach out and engage your healthcare team and make sure that you're getting the care that you need. I am also pleased to report that St. Mary's continues to have currently 0 active acute COVID patients, although we have at least 1 that's under investigation. But we do continue to treat people who are still suffering from the long-term effects of COVID in the hospital. Thanks, Christy.
Thank you, Dr. Adams. Dr. Sullivan.
The only thing I would like to add is, as the other doctors have said, we're continuing to work on providing those vaccinations. So if you have not gotten on a list, it's important to call your PCP to get on their list. We are all trying to work through those lists as we get the vaccine. If you don't have a PCP, I think it's important to remember to establish with a PCP at any one of our organizations. I think it's important to have that relationship, not just during COVID or to get the vaccine, but we really want you to have a primary care physician or provider to address all your healthcare needs, outside of COVID as well. The other thing is the state of Missouri has partnered with community health centers across the state to host COVID-19 testing events, and the Community Health Center of Central Missouri is going to continue to host those events in Jefferson City through February and March. So we currently have testing events scheduled for February 17th, March 3rd, and March 19th. So if somebody has symptoms of COVID-19 or significant contact with someone that tested positive for COVID-19, they could come through these testing events and get tested free of charge. It is a nasal swab, and it takes about 2 days to get those results back. But that's the only requirement is that you are a Missouri resident. So if somebody needs testing, that is an option. These testing events also help us to be able to diagnose COVID-19 in early stages. So the earlier you can get that diagnosis made, you can isolate, notify your close contacts, and follow up with your primary care physician or provider, just so we can closely follow you. So I just want to make sure everybody was aware of those testing events and kind of a little bit about those. So that's all that I had this morning.
Thank you, Dr. Sullivan. Ron Rockwood from Jefferson City Medical Group. Ron, you're on mute.
Sorry, thanks. I thought I unmuted myself. So good morning. JCMG continues to work with the vaccination efforts here at the group. We've got close to 1,000 patients scheduled for our clinics that are running today, tomorrow, and Friday. We had over 1,000 patients last week. Majority of our patients we're reaching out to via phone call to get them scheduled, recognizing limitations of some of our patient population not having internet access to be able to book those online appointments. So we kind of have made that switch in the last week and a half. So we're happy that we're getting through that waiting list. Just reiterating what Dr. Hayden said regarding after you're receiving the vaccine, it's not immediately effective, so continue to wear that mask, social distance, and keep those hands clean. Thank you.
Thank you. Sam from Cole County.
Yeah, I'm going to talk a little bit more on logistics for our clinic tomorrow. At 7:15, there will be a press conference. So I would encourage, we have a lot of press on here, to come over at 7:15, and we will have people from the National Guard and everybody who can speak to you. We can show you the setup. During the vaccination clinic, because of HIPAA laws, we really can't allow you to photograph in the link. So come on over at 7:15, bring donuts. But one thing I want to encourage the people who have appointments to come get vaccinated. If your appointment's at 10:30, don't show up at 9:30. Parking is limited there. The National Guard will be helping with parking, but come about 15 minutes before your appointment. If you are the only one that has the appointment and your spouse is with you, have them remain in the car. If you're bringing kids or grandkids, they're going to have to stay in the car as well, because really what we need to see is the patient who's getting vaccinated. So don't come early, just come on time, and we will get you in and out very quickly. And this is just the first of hopefully many clinics we'll be having. So that is all I have to say.
Thank you, Sam. Very good points. Carrie for the City of Jefferson.
Thank you. And the events that were discussed, like what Sam mentioned, are by appointment only. So want to make sure that is definitely clear, and we appreciate all the organization on that. I want to remind everyone that we do still have the city and county advisory in effect. So please take our advice, and if you're sick, stay home. Continue to keep your distance, avoid close contact, and avoid close gatherings. Wear your mask, try to shop as contactless as possible and space out in restaurants when you're there. So continue to support local businesses, just do it safely from a distance and space out as much as possible. Continue the prevention and patience and precautions. We appreciate all those good that we've been forming and continuing to do so. We also do have these recorded, and we share them on our city's Facebook page, which is City of Jefferson, Missouri. We get those posted in the afternoon of our press briefings. So we started recording it a little bit into this press conference, so we may have Dr. Haight reiterate a few of his key points, so we'll be able to share those, and then we can close with Christy giving a few of her points from the beginning. Thank you. Dr. Haight?
So again, just talking about the vaccine, we have access to Pfizer and Moderna vaccine, both of which are about 95% effective, which is excellent. It's been very safe, not only in our community, but elsewhere. What we do notice, some people after the first and second shots will have a sore arm for 1 to 2 days. Most patients actually, when they get the shot, may not even notice that they've received a shot, but you may notice a sore arm a few hours later. In addition, a small number in the first and a few more in the second, after the second shot, may have flu-like symptoms, which include muscle aches, fatigue, as well as low-grade temperatures or fevers. You can treat with Tylenol or acetaminophen or a non-steroidal, but before doing that, we do ask you to talk to your personal physician to make sure that those medications are safe for you. We also want everyone to make sure that they're well hydrated. That means drink plenty of water before you come in to have your flu shot, as well as following, the COVID shot, as well as following the COVID shot. And make sure that you're not skipping your meals either. We want to make sure that you have enough energy for all of the vaccination as well. Thank you.
Thank you, Dr. Haight. Dr. Sullivan, I did receive a request via email for you to talk about the testing events and where the locations were. They got the dates, but they didn't get the location.
Okay, I can go over that. It will be Wednesday, February the 17th from 9 a.m. to 3 p.m. Wednesday, March the 3rd from 9 a.m. to 3 p.m. Friday, March the 19th from 9 a.m. to 3 p.m. And all of those locations will be at the American Legion at 1423 Tanner Bridge Road. We do ask that you register in advance for those testing if you can. And you can do that by going to health.mo.gov/community test or by calling 919-351-6256.
Perfect. Thank you, Dr. Sullivan. So as Mayor Turgeon pointed out, this was not recorded at the beginning, so I will reiterate a few things. We talked about how the positive cases have been lower, the hospitalizations have been lower, the vaccine supply has also been lower. So we need to continue all those preventative measures that we've been taking and practice patience while we're waiting for enough vaccines to be in the community. We're all working hard at our clinics to host mass vaccination clinics or give vaccines through our regular clinic hours. We will be working together as a regional implementation team to schedule more vaccine events as vaccine supply becomes more available. And there is the new high throughput partnership that Capital Region Medical Center and SSM St. Mary's have through the Missouri Department of Health and Senior Services that was announced by them Monday. And then I did put the organizations that are involved in the event tomorrow in the chat. That way you don't have to listen to me list them again. But I do want to recognize all of the organizations that are putting in so much work for this event tomorrow, and we're so appreciative. And we're hopeful to vaccinate about 2,000 residents tomorrow, as pointed out, by appointment only and through the National Guard event. So at this time, I will open up for questions unless there's anyone that I missed, or Mayor Turgeon, if you had any more questions or comments you want to make sure we're covered.
Christy, I was going to say one more thing. You mentioned it, and I forgot to. Entrance is through the roundabout. So don't come in on the boys and girls side, but enter from the entrance there at the roundabout, and there will be National Guardsmen there to kind of direct you to parking. So, if you would please tell everybody who's coming that is how you come into the link.
Yes, and there is a question in the chat about people being able to choose which vaccine they want tomorrow. No, we were supplied only with Pfizer vaccine, so that will be the only vaccine that will be available tomorrow because that is what is being supplied for the event.
The second part of that question, are people pushed toward one versus the other? And the answer to that is also no. Either the Pfizer or the Moderna is being provided to us. Initially, I think this is true for St. Mary's as well. We were given Pfizer vaccine. With the high throughput, we are provided Moderna vaccine. So again, we get the vaccine and we're able to provide the vaccine that we're given to our patients. Because of their similar efficacy, which is 95%, they are very similar. And so again, we would encourage you to take whichever vaccine is available to you when you're called to schedule your appointment.
Thank you, Dr. Haight, for that second part of that question. So is there any other questions today?
Hi there, this is Connor Hirsch with ABC 17. Thank you so much for doing this. I have a few questions today. Kind of thinking about the mass vaccination that we're going to see tomorrow. I know you kind of touched on this last week, but about vaccine waste. How is the health department, and then also just kind of on the smaller scale as well, how are you continuing to make sure that no doses of the vaccine go to waste, and especially at these large scale events by appointment only, that if someone like doesn't show up to the event, how are you making sure that none of those doses go to waste?
Sure. So at the health department, we do try to look ahead and start counting how many doses we have that have been mixed up, how many appointments, people we have coming in. And if we're noticing at the end of the day that, we have 5 vaccines laying there ready and we only have 2 more coming, we start making phone calls. Because of course we have a list of thousands of people that are ready. So we just keep calling until someone can come. And tomorrow at the event, we'll have people that are doing the mixing in the back and drawing up syringes. So towards the end of the day, they'll start watching, our numbers and making sure that we're not mixing up too much, because we can keep it for Monday. We don't have to give it all tomorrow if we don't have patients scheduled. But towards the end of the day, if we see that people haven't showed up, we will have a list with us and we will start calling. We will make sure that no dose is wasted. And I don't know if anybody else wants to speak to the other mass vaccination events, but we all have a list. So there may be phone calls at the end of the day tomorrow to see if people can get there as quickly as possible.
Definitely. Thank you. And just kind of like in any of the hospitals, or I know last week you said that no doses have been wasted right now. Is that still true? Is anyone reporting any like wasted doses or anything right now? Or is it still everything pretty good?
Great, Connor. It's such a valuable resource that we make sure that it gets into someone's arm who wants it. So.
Hi, this is Jessica with KRCG 13. I know this on the site, the Missouri vaccination site says this is a walkthrough event. How exactly is that going to work with all of these different people kind of coming to the link, entering that roundabout area?
Sure. The reason it's listed as a walkthrough event is some of the other National Guards were actually drive-through where people stayed in their cars. And at this event, we're actually having it inside. So people will park and they will get out of their car and they'll go to the entrance of the link and they will be asked what time their appointment is. And they will be expected to have an appointment to be able to be let into the event. And then we'll filter them into chairs that are 6 feet apart, and they will be given their vaccine while sitting in a chair. They will have to wait their 15 minutes. The whole row will be done and then they will exit. So that's why our event is termed as a walkthrough versus a drive-through, because people will actually be inside a building, not staying in their vehicles.
Right. Thank you, Christy. And then I know in some of the mass vaccination events that have happened, people from other regions, for example, in the one in Mexico, people from other regions drove to Mexico to get the vaccine. Are most of the people that are getting their vaccine tomorrow from our region?
I would say the majority are from our region because they were on our list, but there is no mandate that we have to only administer the vaccine to people in our county or our region. We've been told they're Missouri residents. So, if someone was on our list from a few counties away, we're certainly going to give them the vaccine. But I wouldn't anticipate people driving, too far away in hopes of getting it unless they have an appointment, since this is an appointment only event.
And then, sorry if I missed this earlier, but with the mass vaccination event, for scheduling people, did you call them off of the list that everyone had, or were people just able to sign up?
We had a list, and central bank companies helped us with calling in and making those appointments.
Okay. How is that equally distributed among the various lists from the different health agencies?
So our list had people from all over the region, like you said, and all the various healthcare organizations. And since the health department was sort of the first entity to start making a list, we felt like these people had been on the list the longest and that we should try to go ahead and serve those clients. The other was ease of being able to quickly identify 2,000 people that were ready and eligible for the vaccine, because this was a quick event and on very short notice. So like I said, this won't be the last event we have. We'll continue to serve and we'll continue to have these events, and we plan to move them around the region to make sure there is equitable distribution of the vaccine.
Awesome. Thank you.
Thank you, Jessica.
Hi, sorry, I have
That's
a
okay.
wonderful question, kind of going on a different topic. Thinking about kind of just, we've seen reports in other counties and other areas of people jumping the line to get the vaccine. And so this is a question for the health department and then also for the hospitals. So have there been any reports of people like maybe not being truthful in their like reporting like they're on the list to get the vaccine? And what steps is the health department and then also the hospitals are you guys taking to like check like IDs, papers, like kind of what are the guards to make sure that people are being truthful in reporting that they are on like in the next phase?
Sure. So when people sign up, they do have to like when we had our survey, they had to select which tier they fell on based on the criteria established by the state. And then on the consent form, there's an attestation that they must sign that what the information they're telling us is truthful. We do check photo ID. There's no way for us to, unless we're the healthcare provider, to specifically verify that they have that health condition. That's another reason why people should contact their healthcare provider first to see if the vaccine is appropriate for them. But you know, at some point, we do have to take people at their word and trust them that they are telling us the right thing, and we are giving them the vaccine based on their attestation as well. So I don't know if the hospitals have any other opinion, but
I think go ahead, Dr. Adams.
I think the state realizes that in the instance of a mass vaccination event, which is a monumental task, that it's impossible to micromanage at a very detailed level. And so the state is the one who asked us to use attestation to verify that they're eligible and in the tier that's ready to be vaccinated.
Connor, you won't pass for 65. I'm sorry. Even if you got a fake ID.
I know. I'll have to try to find my way.
And I'll just add on to what Dr. Adams, as well as what Christy has said, is when you do call your personal physician, primary care physician, or specialist, whoever that may be, they actually can have access to your history and can counsel patients if they actually are in this current phase or not. And so that's very helpful.
This is Mike Lester. You haven't mentioned it, but I do note that you have the authorization form on your website that I guess the guard will be giving that to people as they come in, but it's on your website.
that's correct. We did provide it for those that were able to go to our website and print it out and fill it out in advance. It will help the process go smoother tomorrow. But if those people that are registered are not able to do that, there will be forms on hand to be able to be filled out before the vaccination can occur. Thank you.
Hi, this is Jessica again. Just one last quick question for people who may be just hoping to get a vaccine but don't have an appointment, just to confirm they can't go to the link and just sit there all day?
No, they will not be able to come in unless they have an appointment. The best thing for them to do is to call their provider and get on a list, but they should not come to the link and sit there all day.
Okay, thank you.
Thank you.
Hi, this is Maggie with KMU 8. I had one quick question. So you said you will be checking IDs. Is that true? I don't know.
Yes. Anytime someone presents for a vaccine, we do look at their consent form and we do verify their photo ID.
Is there anything else you suggest people bring to the vaccination site?
I don't think there's any other paperwork or documentation they need to bring. Dr. Haight, Dr. Adams, do you have any other advice?
I would say as the vaccinator is coming to you to give your vaccine, certainly if you have a history of severe allergies or on allergy injections, those standard questions that you let the vaccinator know. Many times we will have that person stay not the 15 minutes that we generally do for the vast majority of our patients receiving the vaccine, but we will actually have them stay longer just so we can observe them longer. So again, as the vaccinator is coming by, they may have questions just to clarify and then be able to counsel patients right before they get the vaccine, as well as making sure that we're keeping patients safe after the vaccine.
Great, thank you.
Thank you all. These are great questions. I feel like we really covered a lot of important information today. Are there any other questions or comments?
Christy, I would just reiterate that the reason this works is because we work together, all of our partners, and that includes everybody on the line. Christy put in the chat that some of our local organizations involved, and this is from our entire pandemic response from the beginning through the continued response through the vaccination process. So those include the National Guard, CAP Region, SSM, JCMG, Community Health Center, Cole County Health Department, Cole County Emergency Management, EMS, Jefferson City Parks and Rec, the link, the police department, the fire is listening and doing what they should, and the media, our media partners, for helping us to convey these messages and get the word out. So that's why I think here in Central Missouri and Cole County and Jefferson City that we've been a really great example, because we all work together and it's all for the good of the community. So thank you all.
So true. So again, as Sam said, we will have that press briefing at the link at 7:15 tomorrow morning. You're all invited to come. You can look inside and see how the whole event is set up. And then before patients arrive, probably around 7:30, you'll be asked to exit the building because of the patient privacy issue. So no videos or interviews will take place during the actual event, but we do want you to have the chance to ask questions and see the layout before it actually begins in the morning. So thank you all for participating today, and we'll see you soon. All right, bye-bye.
Hey, Christy, can I stop you really quick?
Oh, sure.
Can we make note or a statement in regards to how many people are going to be allowed, and preferably it's just the patients, and if they need assistance from their car to the building, that we'll have people there with chairs and things of that nature to assist them?
Sure. Yeah, Sam talked about that a little bit, but we did fail to point out that there will be National Guard and other JCPD and Lincoln University staff in the parking lot. So if you do need assistance to your car, and there will be a lot of spaces up front for those who need handicap accessible parking spaces, and we will make sure that someone is there to help you get to and from the facility. But yes, if you bring others with you, we would ask that they stay in the car or stay outside of the facility during the vaccination event. So thank you, Sierra. All right. Thanks, everyone. Have a great day.